moment, I'm experiencing something called anxiety. My hands are clammy and my stomach is in knots. Almost everyone has the fear of public speaking, which is one effect anxiety has on people. Many people suffer from anxiety but do not know the harmful things it is doing to their body or their health. I myself suffer from anxiety. First, I will discuss the different types of anxiety. Secondly, I will discuss the effects anxiety has. Finally, I will also discuss ways to deal with anxiety. There are many types of anxiety, but they all have the same effects. Chronic anxiety can negatively impact your quality of life. According to the National Institute of Mental Health, about 40 million American adults have some type of anxiety. General anxiety disorder is excessive anxiety for no reason. According to the Anxiety and Depression Association of America, general anxiety disorder affects about 6.8 million American adults a year. General anxiety disorder is diagnosed when extreme worry about a variety of things lasts more than 6 months. Social anxiety disorder is a paralyzing fear of social situations and of being judged or humiliated by others. About 1.5 million American adults live with social anxiety, according to ADAA. The typical age of onset is 13. 36% of patients wait a decade or more before pursuing help. Post-traumatic stress disorder, PTSD, develops after you've witnessed or experienced something traumatic. Common causes can be war, natural disasters, or physical attack. Obsessive compulsive disorder, OCD, is also a type of anxiety disorder. People with OCD are overwhelmed with the desire to perform particular rituals over and over again. Phobias are also anxiety disorders. Common phobias include fear of heights and fear of tight spaces. Panic disorder causes panic attacks, spontaneous feelings of anxiety, terror, or impending doom. People with any type of anxiety disorder may have panic attacks. Now that we have learned about anxiety itself, let's talk about the effects of anxiety. Anxiety can trigger the flight or fight stress response, releasing a flood of chemicals and hormones like adrenaline into your system. In the short term, this increases your pulse and breathing rate so your brain can get more oxygen. If you repeatedly feel anxious and stressed, or if it lasts a long time, your body never gets the signal to return to normal functioning. This can weaken your immune system, leaving you more vulnerable to viral infections. Prolonged stress can lead to an overall feeling of ill health. Vaccines may be less effective in people with anxiety. Your excretory and digestive system also suffers. Some people believe irritable bowel syndrome, IBS, is linked with anxiety disorders. Anxiety may cause loss of appetite and loss of interest in sex. Other symptoms include muscle tension, headaches, and insomnia. People with anxiety disorders are also more at risk for having diabetes, high blood pressure, and heart disease. Now that we have all learned about the effects of anxiety, let's learn about how to cope with having anxiety disorders. Many people have anxiety disorders, but not many know how to cope with having them. According to Jonathan Davidson, MD, who wrote the book, The Anxiety Book, hundreds of scientific studies show that you can manage anxiety by rebalancing your brain's biochemistry and your perception of you and your world. In the book, The Anxiety Book by Mr. Davidson, he states that there are 5 levels of healing. The first level is to change your fearful beliefs. The second level is to vaccinate your anxious mind exposure therapy. The third level is to develop serenity skills. The fourth level is medications. The last level is to diet, exercise, and herbs. Some of the medications that help with anxiety include antidepressants, including Zoloft and Loprexo. Just as examples, so today you all learned about the different types of anxiety, the effects of anxiety, and how to cope with anxiety. In conclusion, anxiety is a very real problem among people in the world, but there are ways to deal with it.